My name is David King. I'm an Assistant Vice President for CHI St. Luke's Health. Welcome. On behalf of the Catholic Health Initiatives, Baylor College of Medicine, Texas Heart Institute, we welcome you to today's news conference. We're joined by a distinguished panel of guests. To my right, Interim Chief Operating Officer of CHI St. Luke's Health, Deborah Lee Eddy. To her right, President and CEO of Baylor College of Medicine, Dr. Paul Klotman. To Dr. Klotman's right, President and CEO of Catholic Health Initiatives, Mr. Kevin Lofton. To Mr. Lofton's right, President and Medical Director of the Texas Heart Institute, Dr. James T. Willerson. And to Dr. Willerson's right, the newly announced President of the CHI St. Luke's Health, Baylor St. Luke's Medical Center, Mr. Wayne Keithley. And we'll begin with Mr. Lofton.
Thank you, David. Good morning, everyone. I'm Kevin Lofton, President and Chief Executive Officer for Catholic Health Initiatives. And I want to thank everyone for joining us today for this really historic day for the greater Houston community. This is a story about a remarkable collaboration, one that will strengthen the clinical, academic, and research ties of four exceptional institutions: CHI St. Luke's Health, Baylor College of Medicine, and the Texas Heart Institute. Before we get kicked off, I'd like to recognize several distinguished individuals who have been key to the success of these four institutions, to the success of the worldwide Texas Medical Center, and to the success of the negotiations that led to these groundbreaking agreements that we are here today to announce. First, one individual who needs no introduction is Dr. Denton Cooley. Dr. Cooley is seated right over here. Dr. Cooley. Again, a man who needs no introduction, is one of the world's most distinguished heart surgeons and the man responsible for creating the Texas Heart Institute more than 50 years ago. I'd also like to thank Leonard Tallerin. Leonard? Leonard has served as the chairman of the board of the new CHI St. Luke's Health System and has been invaluable in his guidance, counsel, and leadership throughout this process. Also like to recognize they're not here with us, Bishops Andy Doyle and Dina Harrison, who made the courageous decision to transfer their health ministry, the St. Luke's Health System, to CHI last spring. We also have with us Leonard Diley. Leonard? Leonard is chair of the Episcopal Foundation, which has provided a wonderful gift of $50 million in thanks for the long-standing relationship between the Texas Heart Institute and the St. Luke's Health System for the promotion of cardiovascular excellence, cardiovascular research, and cardiovascular education throughout the Texas Heart Institute. I believe I can speak for everyone here today when I say how excited we are about the new alliances and opportunities. Working together, we will transform healthcare in the greater Houston area. Together, our organizations possess a virtually unprecedented combination of expertise. We have formed a rock-solid foundation for the region's premier integrated delivery system, one that will create healthier communities throughout the broad research initiatives, academic excellence, and throughout all of the innovative models of care delivery. With Baylor College of Medicine, CHI and St. Luke's Health will build a new state-of-the-art acute care facility to better serve the Houston region. We will also strengthen and expand our research and educational collaborations with the Texas Heart Institute. All of the organizations represented on stage today will collaborate in a bold plan and improve healthcare. Together, we will help to shape the future of healthcare delivery throughout Houston, across America, and throughout the world. These affiliations represent a personal and professional achievement unlike few others I've seen in my 30-plus year career that began south of here in Corpus Christi. Our collaboration is a perfect fit for all of our organizations, and more importantly, for the people that we serve. When CHI assumed sponsorship of St. Luke's Episcopal Health System about 8 months ago, I announced CHI's commitment to build upon and expand the relationships that St. Luke's maintain with several key components of the Texas Medical Center. Today, we are here to announce the fulfillment of that vow and that vision. Thanks again, and now I'd like to invite Dr. Paul Klotman to share his remarks.
This joint venture of Baylor and CHI St. Luke's is a defining moment for our organizations, the Texas Medical Center, and most importantly, the communities that we serve locally, regionally, and globally. Baylor College of Medicine has been determined to chart a path for its adult private clinical mission that allows it to determine its own future with a committed partner. This joint venture, in which Baylor is co-owner with shared governance in a new hospital on the McNair campus, as well as the existing St. Luke's Hospital and the Texas Medical Center, is the solution to that problem, and our partner, as Kevin says, is a perfect fit. We are pleased to announce this partnership in the new Baylor St. Luke's Medical Center, and we're very excited that it will be part of the CHI St. Luke's health system. This is a nationally prominent, not-for-profit health system intent on succeeding in these challenging times for health care and health management. We're equally pleased to announce that Wayne Keithley, a national leader in the healthcare industry, will be heading our JV's efforts. As president of the Baylor St. Luke's Medical Center, Wayne is a veteran of this industry and is the perfect choice for this initiative. Let me emphasize, this is a unique relationship. Usually medical schools receive support through academic affiliation agreements with their hospitals. In this case, we are a co-owner. We share in the rewards and we share in the risks. It's a novel approach and addresses the challenges facing academic medicine generally and the challenges facing the healthcare industry, but it aligns them together to provide cost-effective, high-quality, cutting-edge medicine. The medical staff will be a mix of full-time Baylor faculty members and community physicians as it is now, and we believe both groups enhance our patient care mission. This new relationship will give patients access to the most cost-effective, high-quality care and also to the latest research on an accelerated timeline. We appreciate the support we have had from the Texas Medical Center and from TMC President Dr. Bobby Robbins all the way. Baylor built a state-of-the-art healthcare facility on the McNair campus. We opened the outpatient part of it last year, and the first clinics now serving patients through the regions are open as well. The hospital part of the building has remained vacant but ready to be built out. At the same time, CHI St. Luke's has provided excellent care for decades at its hospital and the Texas Medical Center, but it needs a new facility to meet future healthcare challenges. As Kevin said, it's a perfect fit. Our Board of Trustees recognize this and endorse this direction with enthusiasm, and several of them are here today. Our current board chair, Jim Hackett, our former board chair, Mark Shapiro, along with Dr. John Anderson, Bob Bruton, Dave Baldwin, Larry Hurd, Judge Carolyn King, and Chuck Watson are all here today to support this. CHI St. Luke's and Baylor, through this joint venture, will build out the new hospital, initially with 250 beds, but with the capacity to add hundreds of more beds as needed. The current St. Luke's Hospital, newly named Baylor St. Luke's Medical Center at the TMC, and a part of CHI St. Luke's Health, will continue to operate while this new hospital project unfolds. This is a great solution for care in Houston. Baylor College of Medicine remains an independent organization. This agreement covers an important part of our clinical mission and our commitment to provide the finest health care available. Our strong relationship with our other hospital affiliates will not change, and in fact, we hope will get stronger. We're so fortunate to have close affiliations with Texas Children's Hospital, led by Mark Wallace, who is here today, Harris Health, the DeBakey VA Medical Center, Tier Memorial Hermann, the Menninger Clinic, and Children's Hospital of San Antonio. This is a great day for all of us. It is a forward-thinking strategy that combines the strengths we all have to ensure that the community of Houston, the region, and beyond has access to the best health care available. As just one example, we're excited to work with Dr. Jim Willerson and his team at the Texas Heart Institute and CHI St. Luke's leadership to create a cardiovascular center of excellence at the McNair campus. We intend to create additional centers of excellence, including a cancer center and a center for precision medicine. This is a vision we all share for the future, and it's one that will really be great for the Houston community. I'd now like to invite my friend Jim Willerson to share his remarks with you.
All of us at the Texas Heart Institute are very excited and pleased about this new affiliation with the Catholic Health Initiatives and the Baylor College of Medicine. I also want to recognize and thank the Texas Heart Institute's board chairman, David Grimes, who has led our team to this historic agreement over many hours of negotiation in the past few months, and in a very unselfish way. He and the Texas Heart Institute Executive Committee, most of whom are here, have our great appreciation for all they've done to bring us to this moment. Also, our great appreciation to Mr. Isaac Arnold, the first chairman of the Texas Heart Institute Board, to Meredith Long, a very long-serving board chairman, and to Steve Miller, the immediate past chair of our board. Thank you also to our colleagues and friends at Catholic Health, St. Luke's, and the Baylor College of Medicine. And thank you to Dr. Klotman and the Baylor College of Medicine team, with whom we have now embarked very enthusiastically on what will be a historic journey. The Texas Heart Institute brand for excellence and cutting-edge science in cardiovascular medicine and advancements in treatment and education are well established and recognized throughout the world. Dr. Cooley and I have long shared a dream for a dedicated heart hospital, guys, to be planned, and which we expect to make a reality through our collaboration with CHI and Baylor in the months ahead. From THI's perspective, we believe this new collaboration will enable us to bring even more remarkable medical advancements into practice very quickly. We're in a golden age of research that will only get greater. Development, care, and prevention that will help us with our goal of eradicating the #1 killer of men, women, and children throughout the world, cardiovascular disease. This affiliation with these strong and respected institutions is only the beginning of an exciting new opportunity to build on the shining legacy already established at the Texas Heart Institute and the Baylor College of Medicine, the Texas Children's Hospital, and their partners. Someone I admire and often quote, Winston Churchill, said in a different context, "We shall not fail or falter. We shall not weaken or tire. Give us the tools and we'll finish the job." The job is eradicating cardiovascular disease for the Texas Heart Institute. This affiliation is an important new tool, and now we are far better prepared to finish the job. We will not weaken or tire. Mr. Lofton, we're very grateful for this opportunity. We're also gratified in that this affiliation is a milestone for the Texas Medical Center. Over last year, as one reads about arguments and disputes and separations, this is a marriage. This is unique for the Texas Medical Center, the largest medical center in the world, but it's an enormous step forward to the people with diseases of all kinds and what will mean. And young people who want to train in medicine in all of its areas and the health care for our country. This represents a real commitment from Baylor, from the Texas Heart Institute and CHI, and from the leader of the Texas Medical Center, Dr. Bobby Robbins, and one that Houston and Texas can be and will be very proud of as we move forward. Most importantly, our collaboration represents an enormous opportunity for the millions of people across the world who have or are at risk of cardiovascular disease. We're very proud to be part of it. Thank you.
So we'll now open to questions from the media. If you'll please, again, identify yourself and your organization. We have microphones, and we'll meet you where you are. So we're open for questions. Rhonda.
Yes, my name is Rhonda Wendler. I'm with Texas Medical Center News. I'm curious about what will happen to the current St. Luke's Hospital in the heart of the medical center.
The current plan is to build out the facility at the McNair campus. There will be a planning process, a facility planning process that the JV board will undertake immediately. And based on the findings there will be some rationalization of services, and decisions will be made around which services should be located in which particular entity. So it's too soon to actually say what will become of it, but one of the first important steps that the JV board will have to take on is understanding the needs, the capacity requirements, and rationalizing care across the two campuses.
The only thing I would add is that, I think that it's really important for us to preserve all the outstanding clinical programs that are in operation today and to try to grow those programs at the same time that we imagine the future of a new physical plant and a new facility. So the planning process around what we build and how fast we build it is really important. But most important of all is preserving the loyalty and support of the physician community that we enjoy now, and to continue to grow that and to make the best use of both campuses during that period so that we optimize their relationship with us.
Well, Todd Ackerman, Houston Chronicle, just to follow up on Rhonda's question, but the plan is by the time you've built the second hospital, you will then tear down the existing St. Luke's facility. And what about the St. Luke's professional buildings? Will they remain there, or will there be new professional buildings being built on the campus, the McNair campus?
Again, the plan would be that when all is said and done, the replacement hospital will be 100% on the McNair campus. You obviously would have to have related facilities for medical offices and clinical space and the like. The exact plans in terms of what will happen to the current facilities are yet to be determined, and that will be determined over time as part of the planning process that Dr. Klotman mentioned.
The plans to expand the hospital at the McNair campus, is that the same building, or would there be a second facility built for those 400 beds?
We'll give Wayne you.
It would conceptualize an additional tower adjacent to it and connected, sharing the same infrastructure.
And
So it would require substantial new construction.
Yeah, and that was always intended in the original construction that there would be the potential for a second bed tower. I would point out that the interior design of the facility is very different what was originally intended, and hopefully you'll get a chance to tour through it, but it's a very forward-thinking, lean design facility that's really focused on high throughput, quality, safety, and efficiency.
If the heart center will be part of the phase 1 or phase 2?
We always intended to create an integrated cardiovascular center at the McNair facility. So I'm sure that will be part of the initial planning process.
Hi, Carrie Feibel, Houston Public Radio. Could you please describe in more detail what you described as a new, innovative co-ownership agreement between the medical school and the hospital as opposed to what is considered a traditional affiliation? What exactly does that mean?
Well, if you look at most medical schools, and I've actually talked to Daryl Kirsch, who's the president of the AAMC, most medical schools live off of, I don't hate to say handouts, but live off of affiliation agreements where revenues that are generated from the clinical enterprise support the academic mission. You know, as you probably know, education and research not only don't make money, they lose substantial amounts of money. And so to be a research or education organization, you need sources of revenue that often come from endowments and other gifts and clinical revenue in the case of a medical school. So most medical schools are giant anchors on the back of the health system because they require lots of revenue to support. And what's different about this is that we've entered a joint venture with the medical school along with CHI co-own. We're a minority owner, but we co-own. And so the benefits of whatever revenue is generated come earned to the school, not as a handout, and whatever risks befall the entity, also the medical school shares those risks as well. The key thing is, if you think about the complicated nature of trying to create an efficient, value-based health system where you get the best outcomes for the least amount of money, you can see why academics and healthcare sometimes butt heads. But here's an example where we have to work together to solve it because we're in it. We have skin in the game. This isn't a handout plan. This is a plan to help the CHI system excel and do great. And if they do great, the medical school has resources to thrive as well. And I can guarantee you that is a very novel approach to both academic medicine and to healthcare affiliations with academic schools.
Are you saying that the medical school will take on some of the costs of construction and contribute to that? And also-
We have. We're joint owners.
And what percentage of ownership is
Well, the details of the ownership, I think, are less important than the details of the governance of the entity. The reason I'm not trying to be vague, the equity relationship varies based on contributions of both parties, and that will come and go. One thing is we're part of the CHI health system, so they have to be a majority owner at all times to be books, which we understand. On the other hand, the level of equity is just based on the level of participation we choose. And the great thing about CHI as a partner is they've given us plenty of opportunities to participate to the level that we want. And that, again, is unique and very flexible on their part.
Is there some sort of year-term contract, 30-year contract?
Yeah, we have a 25-year affiliation agreement. We don't have any easy outs. As we said, this is a marriage. It would have to be a really ugly divorce. But, you know, it's tough to get divorced in the Catholic Church. And
And it's hard to get married in the TMC. So
No, over time, many of the agreements that we see that don't make it are ones where the out clauses are built in up front that make it real easy to do that. So that we're in this for the long haul, and it's something that will help Baylor, as Dr. Klopman outlined, to be able to rise in its ranks as leading top 10 medical school in the United States. But it's going to be a shared governance, as he indicated. And then I think the other key here is that we still value and want full participation from independent practice physicians as well, because that currently makes up a large portion of the patients that are taken care of at St. Luke's. And we realize and recognize that this is another aspect of it. It won't be a closed medical staff, and it'll be one where we'll have a shared governance model for physicians as well as the shared governance model for the health system.
And I'd like to just emphasize that last point that Kevin mentioned, is this is an open staff model. This is a model that I'm used to, Wayne's used to. We came from an outstanding academic institution that was an honor roll hospital in New York, and it was an open staff model. What we want is outstanding, excellent physicians, full-time and voluntary. And that's really, you know, it's not who you're employed by, it's the quality of care you provide.
Good morning, Dennis Spellman from News 92 FM here in Houston. The question would be, how will you, when people listen to this story, what is it about this agreement that you'd like them to know that's going to help make healthcare better here and around the nation? Is
that in this region and in this fabulous medical center that we have, there is not an honor roll adult hospital. There's a fabulous cancer hospital, there's a fabulous children's hospital, there's a great VA, it's one of the best public hospitals, but we don't have a top 15 honor roll adult hospital. And we don't have a top 10 medical school. We're the top medical school in Texas, but you know, we should be one of the top in the country, and we should have a hospital that's one of the top in the nation. And it's really important that we've come together with a vision to try and do both of those things. Part of the problem with the TMC is it's very competitive, and if we put everything together and started collaborating, we'd have a much better chance of reaching those aspirational goals. And if you think about from Houston as an economy, it's really important that Houston have leading institutions of health, medical school, education. These are the infrastructure that will lead to the region's growth of the future. And so we think this is a major step forward to try and create what really has been absent in the TMC. And it took a third party with vision and a lot of compromise by a number of institutions, Texas Heart, Baylor, but CHI came in and is really the catalyst for allowing this to happen. I think there's a reason it's a third party that's doing this.
And I think, in short, it's the collaboration aspect of Texas Heart being the only organization of its kind really in the world. That's unique. The prowess of Baylor as a top 10 medical school, and then the collaboration of a national health system that brings to bear different aspects of scale and economies. And another component part of this is that as we continue to develop the expertise here at the CHI Baylor St. Luke's Health Medical Center, we also will look to have Houston as a destination location for other component parts of CHI as we operate in 17 other states. So when you put all that together, this doesn't exist anywhere in the country.
Let me add that this combination, just from the point of view of heart disease, allows patients to enter a clinic and be seen by outstanding doctors, have any conceivable opportunity to help their heart and blood vessels in ways that just simply don't exist in most other places and will continue to get better. Healthcare, medicine, and some of the great advances that are being made in cardiovascular disease and other areas of medicine in a real-time way that help the patient and prevent disease in ways that will be hard to emulate in other places.
Carrie?
Dr. Willerson, you mentioned a new heart hospital. Could you explain what that would entail? And also, someone else mentioned a new cancer center and a center for precision medicine. Can you talk in more detail about what these new goals are, what those would entail as far as physical facilities and so forth?
There's a lot of planning that needs to be done. You've heard that from Mr. Lofton and Dr. Klotman, and that's the case. We have to come together and plan this. But it's certainly my dream and Dr. Cooley's dream. In the world's largest medical center, with 6 million patient visits a year, and with many people in the world dependent on it, there should be a heart hospital to address the number one killer of our time. A heart hospital like the MD Anderson Cancer Center. And it's our dream that that will occur, and we'll work together with our partners to do that. But a heart hospital like no other that you've ever seen or heard of, one dedicated to prevention in ways I just discussed, prediction of disease, therapies that you won't find elsewhere, and leaders in sharing those advances with others, hospitals around the world, and a center that will draw people once again from around the world to deal with their major threat in life.
Josh Middleman, Houston Business Journal. Similarly, would you mind talking about, you covered the new planned hospital on the McNair campus, if you will, the general hospital that you say Houston lacks, the top, overall hospital that's going to replace St. Luke's. Just maybe a statement on that, and also, is there a time frame that you guys are ready to announce in terms of when the heart hospital will be finished, and then the general hospital, if you will?
So the first stage of activity and construction is completing the McNair campus and the build-out. So there's a structure standing today which can be built to roughly 250 beds, and the plan would be to develop that quickly as a platform for adult medical surgical care. What we have to do in parallel, though, is go through a planning process to understand then, in the second phase, the additional tower, what clinical services and programs would best be served in that location, to better understand, certainly I do and others I'm sure as well, to better understand the best future use for the existing campus, which programs to transition to the new campus, in what order. I mean, there's a lot of important detail and nuance to that to be worked out. But clearly, we want to take advantage of and leverage very quickly this new facility on the McNair campus. We want that to be home for adult medicine. As Dr. Klopman referred to in his remarks, it was designed with actually design features that are not seen in the TMC and rarely seen in the United States, borrowing principles of lean design, which emphasize efficiency, but also emphasize patient safety, which remains, of course, a really important issue to providers and also to patients and families as well. So that's our home for adult medicine, and we want to develop that home as quickly as we can. Our rough estimate is that within 18 months, we would be able to support 250 beds at that location. And then again, in parallel, we'll go through the planning process and the development process for the rest of the campus.
Question about names. The name of the new hospital on the McNair campus?
It's all under the same provider number eventually, so the one that's on the McNair campus is Baylor St. Luke's Medical Center, McNair campus. So it's not like they're all strung together, because no one will ever be able to say that. But it's all part of the overriding CHI St. Luke's Health, which is a broader system that will be throughout Texas, the world as we know it, and potentially Saturn.
Known universe.
And so similarly, again, the CHI St. Luke's Health is the system name, and then the line below that would be at the Woodlands Hospital or at patients like that. So it will be comparable to the Baylor St. Luke's Hospital at the Medical Center.
Name. And the Texas Heart Institute will remain very prominent in it. It's the one known around the world in cardiovascular disease. We're not going to lose that.
Again, just a time frame. I know that the first phase is completing the main hospital on the Baylor or on the McNair campus, but as far as the Texas Heart Institute, the new groundbreaking facility, no pun intended, do you know when that might be started and or completed?
That planning phase, a whole master facility, so we don't have a date for that yet. Probably the most solid thing we can talk about is getting the 250 beds up and open, and the rest, lots of planning to come.
And how much will it cost to complete that building out for the 250-bed facility?
You want to give current estimates? No? We don't know.
No, it depends upon it. So our early estimates were around $120 million, but there is, but again, it depends on the detail around which clinical programs would go first. So that's a parallel planning process.
And again, after the 250 beds, the plan calls for how many more beds for this
Up
new
to 400.
additional?
Up to 400.
It
Yeah,
depends.
again, it depends. We're currently licensed for 800 beds at St. Luke's Medical Center. So we can go up to that number. When you look at the direction of inpatient care, we don't know that it'll be that size with the same number of beds, but that's what our license capacity will call for. We think it'll be something smaller than that.
If there are no remaining questions from the media, we will thank our panel and thank you for attending. We'll ask the panel to please remain for photographs and also for interviews. So thank you very much.